Well, good afternoon, everyone. It's really nice to see you to join this this Q&A session on the COVID-19 vaccination. I'm Mandy Lamond, and I'm the Senior Project Lead with South West London CCG, looking after vaccinations within care homes, and also I also do some work with proxy ordering. But what we wanted to do today was to take the opportunity to be able to answer any questions or queries that you have around the COVID-19 vaccination. And we've got the support and expertise of Dr. Paul Riley, who's with us, and also Sadina Agama, who's one of our pharmacy colleagues, who will be able to help you with any queries that you have. So please do take the opportunity to ask any questions. There are no silly questions, there are no wrong questions to ask. This is really a safe space for us to be able to have that discussion and to help you to feel more informed about the COVID-19 vaccination. So I'm going to hand over to Sadina and Paul. Just to say as well, if you prefer not to talk, there is the chat box where you can drop any comments or questions into the chat. So we will be keeping an eye on that as we go as well, so we can make sure that we've answered all your queries today. Okay, so thank you very much, Sadina and Paul.
Thanks very much indeed, Mandy. Shall I introduce myself first, Sadina? So I'm Dr. Paul Riley. I'm a GP in Merton. I work in two surgeries, Wideway Medical Centre and the Rowan Surgery, and I've been the clinical lead for COVID vaccination in care homes in Merton for the last 6 to 7 months or so. And I should say, first of all, thanks so much to all of you for joining the webinar, but also for all the work that you've been doing looking after the population in care homes. They're our most vulnerable population, and I'm full of admiration and respect for the work that you do day in, day out, keeping them healthy and keeping them safe. We've done a number of webinars and information sessions like this over the last few months, and I know that many people have had a lot of questions about COVID vaccination, understandably, because there's so much information coming at you from all sorts of different directions, and it's very difficult sometimes to know what information to listen to, what's truth and what's not true, and what's rumour. And we're here now to help you try and understand more about COVID vaccination, give you the information so that you can make the right choice for you as to whether or not you should go ahead and get vaccinated. So Sadina, I think you have a presentation that you're going to give us, that right, first of all, that covers some of the common questions that have been coming up repeatedly. And then after the presentation, anybody who would like to ask any questions, either through speaking or you can ask them in the chat function as well. We're more than happy to answer them. And I think we've allocated an hour, so up to 3 p.m. we'll answer any questions you have. If we don't know the answer to any questions, we will go away and look them up. And we will come back to you with the answers. And if we run out of time, there's some questions you want answered. Sometimes maybe Chiggy or Mandy, you can collect them. We'll answer them and we'll get the answers back to you then, okay? But as Mandy says, no silly questions. You can ask absolutely anything you want. We want your questions and we want to help you make the right decision for you and for your patients, okay?
Sadina, if you want to introduce yourself, and then I will share the presentation.
My name is Sadina Agama. I am the Chief Pharmacist for the Borough of Merton, and I'm part of the South West London Medicines Optimization team. I'm sure some of you have come across pharmacists working in your care homes. I certainly have a whole team of people that work in care homes. They're part of the team that I manage, and together we've done a lot of work around COVID vaccination. I personally have done lots of these, both within our borough, within our region, within our country, and even internationally. So no question is out of bounds. I've heard it all before. And actually, I see it as a challenge if someone comes up with a question that I haven't heard before. So I implore you to come up with it. I've heard lots and lots of questions that people have. And I think the more questions people ask me, the happier I feel that I've done my job. So it doesn't matter how small your question is, please ask it, because that's what we're here for today. So today we're going to talk to you about the vaccine, how you can get it, what some of the common questions that I've been asked are, and just a little bit about the vaccine. And yeah, then it's over to you to ask us the question. So, Jiggy, when you're ready, I'm happy to start the presentation. So it's a brief presentation just to kind of give you a baseline, but really it's all about your questions, okay? So we're not going to spend too much time on the presentation. It's quite quick. Okay, if you could move to the next slide, please. So as I said, the aim of the session is to support everybody's understanding of the vaccine. So we're hoping that by the end of this session that we've answered your questions. And if we can't answer the questions, as Paul said, we'll go away and we'll come back with the answers. Or if you think of anything after the session, then by all means, channel your questions through Mandy to us and we'll do our best to answer them. The next slide, please. So just before I talk about vaccination, I think it's absolutely important that we remind ourselves of the things that we can all do to slow the spread of the virus. So we still need to wash our hands. Even if we're vaccinated, we must keep our hands clean and free of the vaccine. We must still cover our faces. The masks are here for now, and we need to continue to wear them. We need to continue to remember to wash them if we're using cloth masks, and we need to remember to change them if we're wearing the ones that we wear in the clinical workplace. Okay, we still need to social distance, so making space is important. We're free at the moment, although we would like to be freer, but we still need to keep our distance from each other. Okay, so it's absolutely important. If we don't need to be closer to somebody, you know, closer than a meter, then we mustn't be closer to a meter. We still need to keep that distance. Obviously, you're caring for patients, so you will get closer to patients. But just generally, we need to be mindful of space. We need to increase ventilation, so we need to keep our windows open. We're hoping that the sun will come back, so that we will be opening our windows anyway, but we just need to ensure that wherever we are, that we got good ventilation. And we must reduce our contacts where possible to protect us and those around us. So if we're traveling on public transport, if we're in a shop, wherever, we just need to reduce the close contact with people. And what we're going to talk about is the COVID vaccine. If you cast your minds back to March 2020, and I know as care home staff, it was a very, very, very difficult time for you. At that point, we didn't know what was going on, and we were doing everything we could possibly do to reduce the devastation that the virus was causing. We were all praying for a vaccine. That was the thing that we knew that from the history of vaccination, vaccines can be very effective, and we all wanted a vaccine to get us out of where we were. In December 2020, the vaccine arrived, and I was one of the first people to have the vaccine. And if I told you that I wasn't nervous about having it, I think I would be lying. But I had to think about what was going on. I had to think about the example I had to set to everybody. And I had to be grateful that there was an option that had come our way. So it's quite natural that we would all be a bit apprehensive about having something that was new. But as a pharmacist, I had a lot of confidence in the vaccine. And I knew that I had to set the example. I had to step forward, because other people before me had stepped forward and done the trials. So I had to ask myself, what would be the reason I wouldn't do this? If others have done it and have shown that it could give us some protection. Can I have the next slide, please? So why do we use vaccines anyway? Well, we know vaccines are crucial and they're part of our defense against diseases. They're used for so many things. They're used for the flu. They're used for a lot of the like tetanus, diphtheria, yellow fever, cholera. So there's lots of vaccines, and they've all worked in the past. We've not had any reason to doubt their efficacy. And so for me personally, there was no reason to doubt the efficacy. I'd read all the information. I was confident of the information that was provided. It was as good as it could be at the time. And so I stepped forward and I took my vaccine. I also understood that when enough people are vaccinated, it's harder for the disease to spread. And I think in June now, we can see that. We can see that where people have had the vaccine, the virus is not getting the opportunity to spread as much as it's spreading in the areas where people haven't had the vaccine. And so it's quite important that we realize that by having the vaccine, we're contributing to reducing the spread of the virus in our communities. And taking the vaccine was just not about me. It was about my family. I live with my 83-year-old mother-in-law. I have a family, some of whom have long-term conditions. And so I needed to do this because I was going out to work and coming back home and thinking, if I bring the virus into my home, what is that going to be like? And I know as care home staff, you know what that was like. A lot of you were sleeping with your patients for fear of going out and bringing something in. So having the vaccine, it's along the same veins. It's about protecting you. It's about protecting your family, your friends, your community, and the patients that you care for. Can I have the next slide, please? So we know that vaccines they're made to prevent people from getting serious infectious diseases. We know that if you have an infectious disease, you develop a level of immunity. But it's better to develop that immunity through a vaccine because the long-term effects from having the actual disease are there for us to see. There's so many people who are still suffering the effects of long COVID. My daughter had COVID. She's an university student. And when she had COVID, I was saddened by the effect it had on her energy levels. She was an athlete, 100 meters, 200, cross country, you name it. She's played it, she's done it. And she couldn't even walk up the road with me. And we used to go on very long walks. And she would walk a few houses and say, Mom, I can't do this. I need to go home. So the effect of long COVID for some people is real. There's still people months later that are still struggling. So if we can get the immunity without having that experience, I think you will agree with me that that would be the better way of getting the immunity. And as I said at the beginning, you still need to wear your mask, you still need to wash your hands, you still need to social distance, okay? So the next slide, please. So at the moment, we've got 4 vaccines now, although the 4th one isn't actually in use. So we've got the Pfizer vaccine, the Oxford Astrazeneca vaccine, the Moderna vaccine, and we've got the Johnson & Johnson vaccine also approved for use in the UK. We're not using that yet. And these vaccines are available, well, the Pfizer and the Oxford one are available quite freely. There are fewer sites that use the Moderna vaccine, but whichever vaccine it is, they've all been through rigorous tests for safety and efficacy. So whichever vaccine you're offered, be assured that that vaccine is safe and it is effective. Next slide, please. So in case you weren't aware, you will have 2 injections in your arm. That picture on the right there, that's me having my vaccine for real. It's not a dummy. That was the minute I had to take that deep breath and take that vaccine in my arm. And you will have your second vaccine at least 8 weeks later. Depending on where you have it, if your GP has invited you, you'll be invited back 8 weeks later. If we've come into the home to give the vaccine, we will come back around 8 weeks later. If you went into a community pop-up, chances are that that pop-up will pop up again in 8 weeks later. So there are lots of ways to have the vaccine, but it doesn't matter if you've had the first one in a community pharmacy. Usually you book the second one, but you could have the second one somewhere else. So in the beginning, if we were insisting people went back to the same place to have the vaccine, to be honest with you, right now, we just want people to have both vaccines. So if you've had one and suddenly there's somebody in your care home offering the vaccines and you need a second one, go ahead and have it, okay? We just want people to have both vaccines as soon as they possibly can. And remember that it takes about 3 weeks before you start to become safer from the virus. So you can't just have the vaccine and think, right, that's it, mask off, out to party. No, it does take a while to develop that immunity. Could I have the next slide, please? So who will get the vaccine? Well, for a long time, it was a phased approach. So we started with those most at risk and we worked our ways down the age groups. Well, now anybody over 18 can have the vaccine unless they're under 18, so 16 to 18, and they have a chronic disease or they have a learning disability or they're a carer. Then the licensed vaccine, which is the Pfizer vaccine, is available for patients that are 16 and over. Many of the centres that offer the vaccination, the large centres, they're open from 8 a.m. to at least 8 p.m. This weekend, there's a large clinic at Crystal Palace that's going to go on to 10 p.m. So at the moment, we're opening as many hours as we can to make it as freely available for everybody. And there are many pop-up clinics in the community. So we're going into churches, into mosques, into temples, into community centres, into civic centres. I've been all sorts of places. I've even been on a bus. So we're doing everything we can to make it accessible to people. And, you know, as soon as we find another new venue that will work, we'll go after it and we'll do it, because we believe it's important to make it as easy as possible for people to access the vaccine. Have the next slide, please. So where will it be administered? As I said, your GPs have come together and they're offering it as groups in identified practices or venues. Community vaccination centres. So in Merton, where I work, it's available at Centre Court Shopping Centre or AFC Wimbledon, which is the football park. It's available at the Harlequin Centre in Richmond. It's available all over the place. And actually there's a website, the South West London website, that tells you where they all are, when they're open, what they're offering. So do have a look there if you're unsure, and we can share the link to that afterwards. Some hospitals are still offering it as well. Selected community pharmacists are offering it as well. And as I said, there are pop-up clinics as well all across our boroughs. Next slide, please. So if you remember, I said at the beginning that I've spoken to thousands of people and they've asked me thousands of questions. But what I've done here is I've tried to collate some of the key things that I hear from people. So one of the things that I hear a lot of is the vaccine was developed too quickly. You never get a new iPhone straight away because it has errors. So implying that because it was developed so quickly, there are errors. I've been a pharmacist for almost 30 years, and I can tell you hand on heart that there has never been a product that has been developed in a more robust way. And you will ask, why might that be? So the speed of the approval was possible because March 2020 and the whole world was thrown into this pandemic. There was a global crisis. And as a result, it meant that everybody had to come together to do something about it. So in my career as a pharmacist, I've worked as a clinical trials pharmacist, okay? So I've worked on a lot of major products that we use today. And when those products are being developed, they are top secret. Nobody knows anything about it until the latter stages of the clinical trial. With this clinical trial, the information was made available to all the key researchers, all the government organizations, all the scientists, all the regulatory authorities as the trial was ongoing, because it was absolutely crucial that we got a vaccine that worked, but also that it was available to many companies to produce so that there was enough across the world. It was the first time in the world that all adults needed to have a vaccine. So if we take blood pressure medication, for argument's sake, not everybody takes blood pressure medication. Only a percentage of the world's population take blood pressure medication. So when you're doing a clinical trial on blood pressure medication, it's a small number of patients. It's only in specific groups of patients, whereas this was for everybody. So it was really crucial that we came together and got this done as quickly and as efficiently as possible. The thing to remember also is that the technology for the vaccines, it wasn't developed when COVID hit. A lot of work is done by scientists in labs day in, day out in preparation for situations like this. So there's a lot of science that is developed, that is developed should in case we need it. And the vaccine is one of those things. So the technology was all there. It was about understanding the virus, the genetic code of that virus, and then sharing it with the global scientists. So as I said, everybody came together. Now just think about, imagine a day in your care home when all the other staff from the other care homes came into your care home to do the work. Just picture it. Just imagine that you might be looking after 6 patients each day. Suddenly you've got 6 members of staff to look after those 6 patients. Everything happens quickly. It's more efficient. You've got more people, you've got more knowledge. So think about the virus in that way. The whole world came together. Not a lot was developed in the last 18 months when it comes to medicines or vaccines, because all the resources were put behind the vaccine. Okay, so if anything, it's the opposite. Okay, the new iPhone is only developed by Apple. The vaccine was developed by people across the whole world. That's the difference. Okay. And the last thing is that the regulatory authorities were receiving the information as the stages were going along. So normally a clinical trial goes on through all the phases and then the regulatory authority gets the information. This time around, they were looking at the information as it came along. So of course, it just meant that things would go quicker because they'd seen it, they'd questioned it, they'd studied it, and they'd been doing that right from the start. Can we have the next slide, please? Will it affect my fertility in the future? Well, I can tell you now, I have got 4 new nieces and nephews, okay? They were all born during the COVID. All of their mums had the vaccine, okay? So in terms of its safety in pregnancy, we know now we actually want pregnant women to have it. But I can tell you now also that I get lots and lots of patients. What I forgot to tell you was I actually work as a frontline clinician in the clinic. So I see patients, I talk to them, I talk to specialists. A lot of the fertility specialists, particularly those that are doing IVF, actually ask for their patients to have the vaccine before they have their IVF treatment. Now, if it affected their fertility, they wouldn't be doing that. So we are assured that it doesn't affect your fertility. Babies are being born with all their limbs, with all their faculties. They're absolutely fine. So we don't have anything to worry about. There is no reason for us to believe that it affects your fertility. And we also know that babies are being born. Think about the women that were in the trials that didn't even know they were pregnant. They've gone on to have babies and they're absolutely fine. So we don't need to worry about fertility. It's really not an issue. I have 2 young daughters. They've had it. Okay. I have lots of nieces. They've had it. Next slide, please.
I might just add there, Sabina, sorry,
Yeah.
that my wife had both vaccines during her pregnancy and recently gave birth successfully, and son and mum are doing well. So, we felt that was absolutely the right thing to do. We didn't want her to get COVID while she was pregnant, and so she was appropriately protected, and she's safe and doing really well.
Yes, thank you, Paul. Can we have the next slide, please? So there's been a lot in the news about the Astrazeneca vaccine and the clotting issues, okay? So we are really, really lucky here in the UK because our medicine surveillance systems are really, really robust. We have a system where patients can report any problems, clinicians can report any problems. It's an open and transparent system. And so the incidence of the clots was picked up quite quickly. Having said that, there are many people who have had the Astrazeneca vaccine who've not had a clot because the actual incidence of the clot is very, very, very tiny. And obviously, the more people that have the vaccine, the more we can see the incidence of the clot. So as people are having the vaccine, we're seeing, we're understanding what the clot is about, what sort of patients might be at higher risk. And in any medical intervention, there's always the risk versus the benefits of the product. As a result of all of this information, what's the decision here in the UK is that patients under 40, where there's an alternative, will be offered the alternative. There are times when there isn't an alternative, and I can tell you there are many patients that come into the clinic where we go through the clotting risk, we explain it to them, and they're happy to have any vaccine because they know and understand that the risk is actually very tiny. It is around 10 to 15 per million doses. And it is the first doses. So if you've had the first AstraZeneca vaccine and you've had no problems, as far as we know now, the chances of you having it with the second one is actually very, very, very tiny. It's even tinier than the risk of the first vaccine. And day in, day out, people are still continuing to have the AstraZeneca vaccine with no problem. But we have identified that there can be a problem. There can be this unusual clot. And it's not something that we're shying away from. We talk to patients about it in the clinic. We make sure they understand, and we go ahead and immunize them if they are happy to have the AstraZeneca vaccine. All of the vaccines are closely monitored, so you can be assured that if there was an issue with any of them, that it will be shared and you as a patient will be made aware of them. Now, the next slide, please. So that's the end of it, really, because the next bit is all about you having heard this or having come with any questions to actually ask us the questions, and we'll do our ultimate best to answer them for you. So thank you for listening.
Thank you very much, Sadina. That was a very thorough presentation, and it was really helpful actually to hear some personal stories. So where, where you've been close to your families who had also had the vaccine, and you were talking about your nieces. And likewise, Paul, congratulations on the birth of your son. So that's really nice. Thank you for that. So I wonder if anybody has got any specific question based on what Sedina has just presented, or whether you just have any burning questions anyway. If anybody would like to ask anything, then please do. Or if you want to drop something into the chat.
Are there any things you've seen on WhatsApp? That's what always intrigues me, because then people send me all manner of WhatsApp messages. Is there anything you've seen on WhatsApp that you're not sure about or you want to ask about?
I can see somebody's hand up from Ashmead. Hi, would you like to introduce yourself?
Hello.
Hi.
Yeah, I want to ask somebody about, I have a stroke before. I'm 27 years old. Now I have 32. And I don't know what to do. I don't know. I want to try to speak with the GP, but to do appointment is very hard. It's taking too long, and I don't know what to do. I'm very, very scared because it was very, very hard. I stay in the hospital. I lose the vision. I lost everything, and it's very hard. I don't know. If you can tell me something, it's better to have or not. I don't know.
Paul, would you like to come in?
Yeah, I'm sorry to hear that history, because obviously a relatively young age to have had a stroke, so it's a very unfortunate thing to have happened, and I hope that you're recovering well. I would just ask, what is it specifically that you're concerned about with respect to your history of a stroke and having the COVID vaccine? Is there anything in particular that worries you?
I didn't understand very well, but only I'm scared to not have blood clots. Yeah, so, because I have headache often. Yeah, migraine headache is like 2 times per week. I need to have this very strong headache, and they say if you have vaccine you can have headache, but this is scare me very much, because when I have the stroke was very, very strong headache, and after that I lost the vision, I lost left side, everything, and yeah.
So none of the vaccines are associated with any increase in risk of stroke at all. Okay, that's the first thing to say, or migraine. So there's no reason, because you have a history of stroke, to be worried about having the vaccine. And I would say anybody with a history of or significant medical history or long-term chronic condition or chronic disease, it's even more important that they get vaccinated, because the chances are that they're at an increased risk of getting severe illness if you were to get COVID-19. You may be worried about clots and the Astrazeneca vaccine, but in actual fact, the clot risk is very, very small. So very few people, as Sedina said, actually suffer with clots. And B, even if you have a history of clots, the way that the clots develop after the vaccine is a very specific, rare kind of disorder related to your genes. And only if you have something called heparin-induced thrombocytopenia, which is a very long name, difficult to remember. It's sometimes abbreviated to HIT. If you have a history of HIT, then you shouldn't have AstraZeneca vaccine, because you can then be at risk or increased risk of having a clot following AstraZeneca. If you do not have HIT, even if you have a history of blood clots, it is safe to go ahead and have the AstraZeneca vaccine. So I don't believe this applies in your case. And in your case, I would strongly recommend that you do go ahead and have the COVID vaccine.
Yeah, I will do appointment, go to the doctor to my history, everything. If they will tell me which one is better, or yeah.
So do you mind if I ask how old you are?
32.
32?
Yeah.
Okay. So for healthy patients who are under the age of 40, the recommendation is anyway that you have a non-Astrazeneca vaccine, so either Pfizer or Moderna. And obviously, if you have Pfizer or Moderna, the clots are not an issue at all. I would recommend that you do go ahead and have your vaccination. There is no increased risk in stroke associated with any of the vaccines. And that would be what I would suggest for you to protect yourself and obviously the people that you work with in your family and the community.
Okay, thank you.
Okay.
Thank you.
Just to add as well, we'll put in the chat the email address of the Vaccination Hub. And if you contacted the Vaccination Hub, we can help you to get an appointment. We can assist with that as well, so that you're not, perhaps waiting for a GP type appointment.
Okay, thank you. Thank you.
We'll pop that in there. Hopefully Jiggy will be able to do that as we're chatting. That would be great. Thanks very much for that. That's a really, really useful question, I'm sure, for everybody else as well. Hi, I can see somebody's hand up. Apologies, I can only see on the name Kitchen. Hi.
You're on mute.
You're on mute. If you just hit that's it. You're still on mute. Yeah, you're still on mute there. So can you see, there's a microphone button at the top of your screen, hopefully, where you can switch that off. You just click on there, it should switch your mic on. Okay, so we'll just wait while that lady comes back to us. Ashmead, you still got your hand up. Is that a legacy hand? Would you like to ask something else, or was that from previously? No. Okay, that's great. Thank you. Would anybody else like to ask anything?
There's a question about allergies.
There you go. She'll be back on now.
Oh, she's back on. Okay.
She's back. Hi there.
Hi.
Hi.
Yeah,
Go ahead.
there you go.
Go ahead with your question.
It's me, Martin.
Yes, yeah, that's great.
Hi.
Sorry, I can't see your full name.
Yeah. Hi, my name is Anne-Marie Kabange.
Hello.
My problem is I had sugar problem since my last pregnancy. And my problem is it's not just the vaccine, but my problem is the side effect of the medicine. Myself, it's fine for me. I feel it's fine, but the side effect of the medicine I'm taking, that's it. That's the problem. I don't want to mix up many things. I'm confused myself. Now, my problem, I want to stop first and finish all this sugar. Sometimes you check your sugar, it's fine, it's going down. I want to stop all the medicine what I'm taking. I'm taking a lot of medicine, Novomix, everything. I think 3 medicine I'm taking. That's the problem I want to ask about. If I mix up, it's not gonna be problem or anything. That's I'm scared to get anything. I want to finish it first. I want to deal with my sugar to finish because it keep going slow. The sugar keep going down. I want to finish, then they stop me my medicine, then I can go ahead with the vaccination. That's it. I don't want to mix up because the side effect, I don't know what's going on. I'm scared. That's the problem. I'm confused as well.
Okay, thank you for that. Paul, would you like to respond?
Yeah, okay. Hi, Kitchen. Thanks for your question. It sounds like from what you're saying, you have diabetes. Is that right?
Yes, yeah.
So one of the things that's become really clear over the course of the pandemic is that, unfortunately, people who have diabetes are at really high risk of becoming severely ill if they were to catch COVID-19. So we know people with diabetes, if they get coronavirus, they're much more likely to be severely ill, be admitted to hospital, and unfortunately disproportionately pass away with COVID. So it's really important. We tried really hard to protect the population of people who have diabetes in particular. So for somebody like you with diabetes, having the vaccination, protecting yourself against COVID is super important. It sounds like you're worried about an interaction possibly between all the medications you're taking and the vaccine, but there's no interaction whatsoever between the vaccine and any medications that people are taking. Actually, the vaccine's completely safe, whatever medicines you're taking. And so for you, I would say, don't worry about those interactions. There are no interactions. It's really important that you protect yourself. And I would strongly advise you to have the vaccine.
Yeah, I'll add to that. As I said at the beginning, I'm a pharmacist, so I work with medicines. I'm an expert in medicines. Let's put it out there. Okay, so when it comes to side effects of your medication, you've got nothing to worry about, because the vaccine is never going to make those side effects worse. It really isn't. I was going to talk about side effects generally anyway, because it's one of the things a lot of people are worried about. And I think it's quite natural. I said at the beginning that I was worried when I had to take it, but I knew that the benefit versus the risk, actually, the benefit far outweighed the risk. So every day we make decisions around risk all the time. Everything we do is risk-based. You know, I could be sat in this front of this computer, it could explode, because computers do explode, right? But we're all sat in front of our computers because we've trusted that the risk of the computers exploding just at this minute while we're doing this webinar is actually quite low. So it is about the risk versus the benefit. And it's quite natural for us to be worried. It's a protective function, actually, in the way we operate, to be worried about something, because that something has a potential danger to us. I would say in your case, the diabetes and you know, that you're trying to control probably has a much higher risk to you than the vaccine, okay? But it also contributes to your risk from COVID. So if you think about it in terms of risk, as somebody who's got diabetes, as Paul said, those were the patients we were desperate to immunize in the beginning, because we knew that they were the patients whose outcome from COVID wasn't great. Okay, diabetes is quite common in patients of a Black and minority ethnic group. People ask me all the time, why were we disproportionately affected? Well, part of the reason is we were the ones with these long-term conditions that put us at risk. So if we can do something about those risks, that is one of the best things we can do, because there's certain things we can't change. Being of that ethnicity, we can't change it. It is there. We can't do anything about it, but we can modify our risk. By having the vaccine as a diabetic, you're modifying your risk of an outcome when you've got COVID, a poor outcome, okay? In terms of the actual vaccine and the side effects, now, it is very interesting because I've been thinking a lot about this. So I'm Ghanaian, okay? I go to Ghana a lot. When I'm going to Ghana, I have to have vaccinations. Many people that have to go to Africa, West Africa, have to have vaccinations. Some choose to, some don't. And what has become quite obvious to me when I talk to people is, as adults, a lot of people haven't had vaccinations in a long time, okay? Because when they're traveling, they're tending not to have those travel vaccinations. And as a result, many of them either don't know or have forgotten what post-immunization scenarios are. We take our babies for vaccines. They have about up to six vaccines sometimes. Babies are quite grouchy. We give them some paracetamol and then babies are fine. But as adults, we're not always experiencing what our babies experience, okay? So when you have a COVID vaccine, to be honest, it's no different to having the flu vaccine, because some people have the flu vaccine, they're absolutely fine. Like everybody in my house had the COVID vaccines. Nobody had an achy arm, nobody had anything. We were all absolutely fine. Other people I know have had the vaccine, they've had the headache, they felt malaise. Most people, it's gone in 24, 48 hours, okay? Because I make it a point to follow certain patients up. If I have a patient in the clinic who's really worried, I check on them. I will give them a ring the next day and ask them how they are. Because I think for me, it's really important that patients are supported when they have the side effects. But also it's important for me to hear that the side effect wasn't a problem, because then they can tell other people that actually I had the side effect, I had a headache, I felt a bit malaise, but actually in 48 hours, it was gone, okay? We are all different. So you might have that vaccine and you might not feel a thing, but you might have that vaccine, you might have a headache, you might feel a bit unwell for a short while. So don't worry about it, because honestly, the number of people that have long-term side effects from the vaccine is still actually quite small. And as I said to somebody the other day, you're more likely to hear from the people who had the side effects than the people that don't. Okay, so those of us that haven't had it, we don't say much about it. But those that do are the loudest ones in the system at the moment. So while you're considering what to do, please ponder on what I've just said. Don't worry, don't fear, because honestly, it's never quite as bad as we think it's going to be. Honestly, it isn't.
I think, Sadina, that answers the first question of the anonymous questions as well, which is about the concerns about side effects. Yeah. And I think the next question was, I believe the vaccine, and thank you for that really comprehensive answer. I think it, really supportive to help people in understanding about the side effects. The next question is, I believe the vaccine will make me sterile. What is the proof that it won't do this?
Well, the proof is obviously babies are, since the trial started, several babies have been born, and sterility is not something that's been observed in people that have had the vaccine. So, based on the evidence that we have, that we have no reason to believe that it will cause sterility, but also based on the way the vaccines work, we have no reasons. Based on the biology of the vaccines, we have no reason to believe that they would cause sterility at all. And as I say to people, if you get COVID and unfortunately you don't make it, the sterility is actually the least of your worries.
Paul, did you want to come in there?
Yeah, I was just going to quickly go back to Kitchen, just to finish Kitchen responding to what you were saying. It's really important, actually, whatever you do with respect to vaccination, that you don't stop your diabetes medication, because I know it sounded like you were thinking about maybe stopping your diabetes medication, including insulin, and then going and having the vaccine. I mean, first point which we made was you don't need to stop it. There's no interaction at all between your diabetes medication and the vaccine. That's fine. You shouldn't worry about it. But certainly don't stop your diabetes medication, because we wouldn't want your sugar levels to jump up really high and for you to develop severe complications of high blood sugar levels. Or if you got COVID with high blood sugar levels, that's when COVID becomes really, really dangerous. So please do continue your diabetes medication, whatever you decide to do from a vaccination standpoint. I just wanted to make sure we got that across Kitchen, and I hope that between Sadina and myself, we've helped to alleviate some of your concerns and your worries. But on the sterility question, that there is no reason to believe, as Sadina says, that vaccination will cause sterility at all, because the way the vaccine works, it doesn't interfere with your reproductive organs or your reproductive system in any way, shape or form. And millions, tens of millions around the world, hundreds of millions of people have now received the vaccines. Many of them have been closely monitored and followed up following vaccination, especially in the trials, and there is no evidence whatsoever that vaccination is associated with reduction in fertility or sterility. So it simply it isn't borne out. There is no impact on fertility or sterility from vaccination.
Great, thank you, Paul. Thank you. Joshua, I can see your hand up. Hi.
Hi, hello everyone. Joshua, I have a very simple question. I wanted to find out, because when Sadina was talking earlier on, she said, well, it's obvious that there are so many types of vaccinations. My question is, if you are in Africa, for example, and then you took your first dose in Africa, and then you now moved to England, for example, can you take the second dose in the UK? And does it have to be the first type, the kind of first type you took, or it doesn't really matter? That's my question.
Yeah, no, so there are lots of vaccines across the world at the moment. And if you had your first vaccine in another country and you are here in the UK when a second dose is due, you can have a second one. As best as possible, you would get what you had before if it's available here. So most countries, well, a lot of countries have Astrazeneca, but other countries have other ones. So if you had Astrazeneca, then you would have your Astrazeneca second one here in the UK. If you had one that wasn't available here in the UK, then you would have an alternative one, but you would have to go through, so there are processes in place to sort of consider what vaccine you had, etc., and a decision made about which one you would have. But absolutely, we want everyone to have the second dose of COVID vaccination, and so you would have that. There would be no reason why you wouldn't have it. unless obviously you're not clinically well enough to have it, or there's another clinical reason why you can't have it.
Yeah. Also,
am I going to see you in the clinic soon then, Joshua?
Also,
I actually had COVID myself back in January, and actually I survived it, and you know, we have the vaccines now, so don't worry, I'm safe. I'm good. Thank you.
Joshua, as well, just to give you some reassurance, and anybody else, again, the Vaccination Hub, and we've put the address in the chat. If you or anybody that you know has had a first dose abroad and are due to have the second dose, if you contact the Vaccination Hub, they will help you with regards to that second dose appointment. Again, we can give you support with that. Okay, so the address is in the chat. Sorry, Paul, did you want to come in?
Yeah, thanks for that, Mandy. And also just to say that if it's not possible for whatever reason to give you the same vaccine, although UK guidance currently is that it's preferable for you to have the same vaccine as the second vaccine that you had as the first. Reassuringly, they've recently released data from trials where they've looked at what happens to people who have first vaccination with one vaccine type and the second vaccination with a different vaccine type. And pleasingly, it looks like if that's the case for you, you still get very, very good protection from COVID and coronavirus. So you shouldn't worry if it's not possible for you to have the same vaccine second time round, you have to have a different one. You can now be reassured and confident that you're still getting good protection against coronavirus infection.
That's great. Thank you, Paul. I'm mindful that we've got some questions in the chat. So I think if we pick up on some of those, and maybe in the meantime, if anybody has any more questions, raise your hand and we'll answer them. So I can see one question in the chat that says, is it safe to have the vaccine for someone with low platelets?
Yes, it is the answer. And low platelets is not a problem or a contraindication to vaccination. You're probably asking that because, again, you've heard that you can have this rare phenomenon where very few people sometimes experience a clot after Astrazeneca vaccination. Happens, as Sedina said, to approximately 10 in a million and only on the first dose of Astrazeneca. And the way that clot forms, there's a very specific immune response, which is rare, and that involves somebody's platelets dropping as part of that clotting process. But that does not mean if you have low platelets for any other reason, you should not have the vaccine. Having low platelets does not mean you can't have the vaccine, and you should go ahead and have it.
Great, thank you, Paul. So I hope that gives some reassurance there, but if you do have any more questions on that, do come back to us. Theory, you've got your hand up.
Hello.
Hi.
Hello, good afternoon.
Good
everyone.
afternoon.
Dr. Paul and Sadina. My question is, why they made this vaccine compulsory for the worker in care home, not for the worker in the hospital?
Yeah, so that's a good question. I think you're referring to the likelihood that from October.
It's not a comparison. Yeah, I'm not trying to compare anything. Don't get me wrong, please.
No, I think it's a good question, a fair question. It's referring to the fact that it's very likely that from October, people working in care homes and the care sector will have to be vaccinated in order to be able to continue working in those roles. And the reason I think, I can't really speak for the government actually who've made the decision, but I think the reason is that we know that the most vulnerable people in terms of being susceptible to coronavirus, developing severe illness and or passing away with coronavirus are those people who live in care homes. So that's why when the pandemic started, we saw unfortunately a lot of the deaths occurring first in care homes, and that's why patients who are in care homes and staff there were prioritised as Group 1 for vaccination. They were the people that we wanted to protect first, because we knew that they were the most vulnerable people, and it's most important that they get protected. And so that's why I think they've decided to focus on staff working in care homes, because if you work in the care home, Obviously, getting coronavirus is not just a problem for you, but you can then spread it to all the residents in care homes. And that's what we've seen happen. Once the virus gets into a care home, it spreads really quickly because you've got a lot of vulnerable people in a confined space living closely together. So that's why I think they've decided to make that a rule for care homes, but not necessarily for hospital, where you get all sorts of people in hospitals. Does that help answer your question, Thierry?
It doesn't at all. But anyway, but the thing is, we are all in a permanent contact. You know, with the patients. Either in the hospital or in a care room, we are all in permanent contact, and we are still wearing PPI when we get in contact with service user, wearing our mask. So I don't think we are at risk for them. I don't think so. You know, and the thing is, you know, as they made this vaccine compulsory, it's raised question in people's mind. You know, it's raised question in people's mind, and people are thinking that there is a hidden agenda behind this vaccine. You know, they should. You know, personally, I think they should leave people, you know, to make their own decision whether they want to take it or not, instead of pressuring people and putting pressure on people, because now people are thinking that there is something, you know, they're hiding something. You get what I mean.
So I completely get, you know, I completely do get what you mean. I actually think that a lot of people will feel that way, and a lot of people will feel that way to a degree. And I think this is a really, really difficult decision that the government has taken. I think there's no absolute right or wrong, and I think what they're trying to balance here, Thierry, is individuals' right to make decisions for themselves, which is something that we take really seriously and really importantly. It's one of the fundamental things that we try and protect in this country, individuals' freedom to make their own decisions and do what they want to do, even if other people disagree, even if the government disagrees with those decisions. People have to be free to make decisions that they want to make for themselves. And I agree with you on that point wholeheartedly. At the same time, the government has a responsibility to protect the public at large and broader members of society. And coronavirus is a disease that doesn't just affect individuals, it affects the public. I mean, it's affected public right across the whole world. So the government has to look and think, how do we protect the public? And in particular here, how do we protect the care home population? So, you know, I'm sorry that I didn't manage to explain myself perhaps at best the first time around. But the reason why they're focusing so hard on care homes, to try and explain it again, is because we know that at the start of this pandemic, the residents of care homes were affected worst. And you see this, you've seen this actually in Scotland. In Scotland, care homes were affected particularly badly because the virus was getting into care homes as people were discharged from hospital to go back into the homes. And once the virus got in the homes, it spread like wildfire, and so many deaths happened in care homes, which we now realise could have been prevented if the residents had been vaccinated and the staff had been vaccinated. And so that's why they're so keen to protect the residents in care homes. And one of the ways in which we can do that is to vaccinate staff. I don't believe the government wants to take away the individual choice of staff members to.
But Dr. Paul, in my care room, for example, all the residents have been vaccinated. So why are they telling people if all the residents have been vaccinated, got a vaccine? So I'm not at risk to anyone.
So that's a really good point. And my answer to you is that unfortunately, even if you have been vaccinated, even if you have had both vaccines, it doesn't mean you will not catch coronavirus. It greatly reduces your risk of catching coronavirus. And even if you catch it, it reduces your risk of getting severe illness and needing to go to hospital. But it doesn't mean you can't get it. So even if every resident in your home is doubly vaccinated, if you bring coronavirus into the home, some residents probably will get it. Some residents probably will still get severely ill. Some residents may still pass away, even if they've had both vaccines. Far fewer will get ill and far fewer will pass away than if no one had been vaccinated. But even if they've all been vaccinated, they can still get it. And so that's why Sadina said, even when we're vaccinated, we still have to wear the mask, we still have to wash our hands, we still have to keep our distance from everybody, because the virus can still spread. It's less likely to, but it can. So that's why we would still say staff members need to be fully vaccinated, even when all the residents are.
Can I also
Paul,
add
can I
that,
come in? Sorry.
the vaccine, I was just going to add that the vaccine reduces the transmission of the virus as well. So even if all your residents are immunized, if the staff aren't immunized, then they have a higher risk of transmitting the virus compared to if they are actually immunized. So it's about everybody doing their bit to make the whole okay. And that's what it is. But it's a balance also between what individuals want to do. I think that the other thing to realize is that although they started with care homes, my hunch is that it will be NHS staff as well, because it's a moving feast all the time. They're starting with the highest risk first. And I think when I think about it, if I was ill in hospital, would I want somebody who's not immunized transmitting the virus to me? Would I want that person caring for me? So I sometimes like to look at it from a personal point of view. If I was the person in the care home, if I was the person in the bed, would I want that for me or my family? If it was my mum or my mother-in-law who's just come out of hospital, as it happened, I wouldn't be happy knowing that she could have been exposed to the virus because somebody's made their personal decision not to have the vaccine. So it is a very difficult ethical and moral discussion, but a line has to be drawn somewhere. And lines will be drawn. It's not even one line. And you touched on something that I just need to pick on, because when it comes to the vaccine, there's a lot of conspiracy thinking around it. I see a lot of videos people send me, whatever. It's quite intriguing, actually, some of it. But I think the whole thing about the hidden agenda, where the words I heard you use, well, millions of people have had the vaccine. So that agenda can't be hidden, because millions of people have had the vaccine. So I will be intrigued to know what the hidden agenda people think it is. If actually millions of other people have had it, they weren't forced into having it, they had it. Okay, so what is the hidden agenda really? Because you could choose to have it, or you could choose not to have it, or you need to have it. But ultimately, the outcome is the same. You've had it and you're protected. So people come up with lots of things that they think about, and we all think differently. But I think I implore people to really think critically about the conspiracy side of it, or the hidden agenda side of it, more critically, and really ask questions. Is it really hidden if hundreds of millions of people across the world have had it? I work in the clinic. When a vial is open for the vaccine, I don't point out who's got to have it. Whoever's in the queue has it. People aren't selected to have it in any way whatsoever. We don't tell people to go to any particular clinic to have it. We don't force people into having any particular vaccine. So if there was a hidden agenda, I wonder how that, it makes me think, the whole hidden agenda thing. And I think we all need to think critically about how we think about that, because we need to be clear and have evidence, even maybe there's a hidden agenda. I don't see it. I know many people aren't seeing it. So I'm curious when people can see it or think it.
Thank you, Paul and Sadina. I was wanting to come back on 2 points. Thierry, you were talking about wearing masks, and what I also wanted to add is that many people carry this virus asymptomatically. So you may not even realize that you have the virus, and even the residents may not even realize they have the virus, even if they've been vaccinated 2 times, because they are asymptomatic. I know people are continuously being tested, which is fantastic, but in between those times, at some point, you may encounter them and then spread this on. So that continue wearing that PPE at the time now, and if you have any chance to lower that risk in any way, for not only for yourselves, your residents, the people you meet in the street, the public transport, your families, you're lowering the risk for everybody if you receive the vaccine. And I also wanted to add, I know we're slightly over, but Sedina and Paul, do you have any capacity to continue for another 15 minutes or so?
Yeah.
There are a few more questions, and also I see other people with their hands up. Mandy, are you able to continue as well?
Absolutely, absolutely no problem at all. And please, if you do have any questions, knowing we've got 15 minutes more, then please do put your hands up, and we will, we will make sure that we answer those questions for you. In the meantime, I'm just looking in the chat just to make sure we've covered off some of the questions that came in. So there was a question around, does the vaccine stop you getting COVID? And if so, what's the point? And I think we've answered that one, haven't we, just? So I hope you feel that that's been covered. We've talked about allergies as well. Then there was another comment. If I've had COVID already, I don't think think that there's a need to be vaccinated. And I think again we've covered that, Sedina and Paul.
Yeah. So the thing about the immunity from when you've had COVID and the immunity with the vaccines, it's a developing picture. So we know that if you've had COVID, you at the time you would have developed some antibodies. But what we don't know is how long those antibodies will last for. So, patients who've had COVID have all had the vaccination as well, because it is about lengthening the level of immunity. And I know that at the moment, we've got patients who've had the vaccine for over a year now, and their antibodies are being monitored, both those who've had COVID and those who've had the vaccine. So the information from that will guide what happens next. And already there's some talk, because of the variants, there's some talk about the boosters, because you might have had COVID from one variant, but now the virus that is common in the community is a different variant. Okay, so it's a moving picture really in terms of our immunity and how it's developing and what we need to do. So even if you've had COVID, it's strongly advisable for you to have the vaccine.
Great, thank you. Paul, did you want to add anything?
Not specifically to that, other than to endorse what Sedina has said, but I think Kitchen has written something relating to possibility of developing disorders after having the COVID vaccine, and in particular you referenced nervous system disorders. Kitchen, is that right, and is that something that you're worried about?
It was a different kitchen, wasn't it? Kitchen HF, was it, or was it another one? There were two kitchens.
Oh, I'm sorry. I think it's a Kitchen HF. Yeah. I don't know if Kitchen HF is still with us.
I think they've gone. There was a group of people in that one that they've disappeared off the screen.
Okay. I mean, for everybody else, and it's being recorded too, I think it's worth saying one of the things that will happen when you give a medicine or a vaccine to so many people, like we have with the COVID vaccination, it's a slightly unusual circumstance. As Sedina was saying, almost everyone has had it. Is that some people after vaccination will develop different disorders, just like every single day people go to visit their GP or the hospital with new symptoms and they get new diagnoses. Now, because we're giving the vaccine to everybody, many people will go, like they would have done even if they hadn't had the vaccine, develop symptoms, see the doctor, have some tests and be given a diagnosis of something. Now in their minds, they may think, well, hang on a minute, I had the vaccine last week and suddenly I've got a diagnosis of this nervous system disorder or that lung disorder or this bowel disorder. And people will often think, well, it must have been the vaccine that's caused it, when in reality, many people will have developed these diseases anyway, and it's not related to the vaccine at all. And so this is a phenomenon that we have started to see with some people in particular, perhaps going on social media or wherever and saying, I had the vaccine and then I developed this, when in fact they would have developed it anyway. And so what you need to do is very careful studies and very careful analysis to look at the number of people developing these things after the vaccine versus the number of people who you would expect to develop these things when vaccine wasn't around and wasn't being given. And to my knowledge, we have not seen any increase in nervous system disorders in patients who've had vaccines over and above what you would normally expect in the general population when you look at them at a time when we weren't giving the vaccine. there's a slightly difficult concept to explain, but you know, hopefully you can see that actually a lot of people may think they've developed things from the vaccine. They haven't. They would have got it anyway. And we're just seeing this coming up time and time again because so many people have had the vaccine. So people are getting diagnosed with things shortly after and thinking the vaccine caused it. There is no evidence that that's the case.
Yeah, I mean, I think the other thing to remember is that the yellow card reporting system is that it's the reporting system. So it's fueled by all reports. So I can send a report in right now and say, I just listened to a webinar and I've got a headache. I can do that, okay? There is nothing that says the webinar caused the headache. I might have got the headache anyway. So I think people might not always understand that when the reports are done, many of them are followed up, but not all of them necessarily. Sometimes the information provided isn't even enough to make a judgment, but it's been reported. So it is reported as part of the MHRA reporting systems as well. And you're right, Paulie, you know, the background risks and incidents of all of these side effects is what we need to be looking at. And I think it's fair to say we've all been at home, we've all got time, we've all read so many things we would never have read before. The number of people that have got medicines who've never read the leaflet in the box, but actually with the vaccination, people have read every last word and whatever. So I think we're more informed, but I guess we're more informed through the lens of a COVID vaccine. And so it's very easy for people to make associations with things because it's all about the COVID vaccine at the moment, and it's something we've all had. It's a very, very unusual situation. We will never see this in our lifetime again, but it is what it is, and we have to kind of deal with it and sort of reassure people as we go along.
Great, thank you. Sadina, in the comments, and this is going back to the discussion about immunity, I think, so the previous discussion, and it just says, if I can find it, apologies.
Was it about the vaccine every year?
Yes, that's right. Do we
vaccine every year? Well, who knows? At the moment, we think that we will need to have boosters. For what we know about viruses, if you look at the flu, we have to have one every year because of the mutation of the virus, the different variants. So every flu vaccine that we have each year is slightly different because the flu vaccine is based on what happens in the Southern Hemisphere, so around Australia, the previous season, and the vaccines that we get are based on what's happened there and they're produced. The viruses change. And so I don't know. It's anybody's guess whether we'll have to have it every year and whether it will be everybody. We're all waiting patiently because the government has promised they will tell us about that in the next few weeks. So we're all waiting to see, you know, what the science is telling us, what the experience is telling us, and what we need to do. So unfortunately, I don't have the answer, but it's definitely looking like this year we'll have to have another one. Whether we'll have it every year, that I don't know.
No, right. Thank you. So we have 4 minutes left, and I just wonder if there are any more questions. Thierry, I can see that your hand is still raised, and I wonder if that's a legacy hand or whether you have it.
Mandy, that's a legacy hand, but there is another guest, Shelley.
Okay, sorry, I can't see Shelley. Apologies. Shelley, would you like to ask a question?
You just need to unmute.
Hi.
Hi.
Unmute. Can you hear me?
We can hear you. We can hear you, Shelley.
Okay. The vaccine. Yeah. Okay. I've never catch COVID. I have an underlying problem. I have an underlying problem also. Never had COVID. And keep myself safe. I don't work inside of where the residents are. I work at the day center. I start at 5 till 8. When I go to the day center, there is no resident, no one there. So I'm thinking, why do I need a vaccine? And I'm thinking they are not on the law registration to get a vaccine at that side, I think. So I'm thinking, why should I have a vaccine at the moment? I don't see the resident. I don't need to go near the resident. I don't walk on their floor or nothing like that. It's like forcing me to do something that I don't want to do.
Okay. Paul or Jigger, did you want to respond to that?
Hi Shelley Ann. I think Of course, this is completely your decision, and everything you decide will you need to receive the evidence behind making your decision. What I would like to share with you is that the virus remains live on different surfaces for between a number of hours to a number of days to 3 days. So this could be on metal, wood, paper, your hairbrush, your computer that you're working at, a light switch that you've touched. If you vaccinate yourself, then not only would you protect yourself if somebody else has touched that light switch or hand or the tap or anything where the virus is, also would protect the other person in case you are shedding it onto that surface as well. So working in not that you're with the resident directly, but working in an area or an environment where there is vulnerable people, those other people who meet or make contact with the virus spread it onto those vulnerable people, or in the other way, they could spread it onto you. Does that make sense? Ellie?
Yeah, that does make sense. But can you hear me?
Yes.
Hello, can you hear me? I'm on the road, that's why. As I said before, someone said it in the meeting because I was here and everything. I think the government is forcing someone to do stuff that they don't want to. It's like living in South Korea or you're living in China, you have to do what the government said. This is Great Britain. I think everyone have a law of human rights and everyone have a law that consists from 1980 something that no government can force you to take a military vaccine or anything against your will. There was a law that said that before, and it's like they're changing their law now. Want to force you into a vaccine.
I understand, Shelley.
Sorry,
you go ahead.
One point I might add on that front, and it's relevant to you too, Thierry. As I said before, obviously we in this country place great emphasis on the ability for individuals to make decisions for themselves, and I think you probably were referring to North Korea rather than South Korea and China in your examples. But there is precedent.
Yes, it's the same. Both of them is the same.
But yeah, but there is precedent. So in the NHS, for example, if you want to work in certain jobs in the NHS, you need to be vaccinated against certain viruses. The good example is hepatitis B virus. So if you want to be a surgeon operating in operating theatres, you have to be vaccinated against hepatitis B. Otherwise, you cannot work as a surgeon. Now, you might say, but I have my own free will. I'm a surgeon. I don't want the vaccine. Thank you very much, but I want to do this job. But the government has said for a long time, in this case, it's imperative that we protect the population of patients who need to undergo surgery. And we actually say that the health of the population of patients who need the surgery outweighs the right of an individual in this circumstance to say, I don't want to be vaccinated. And therefore, if you're a surgeon and you say, I'm not going to have the vaccine, you can't operate. So that's exactly the same as what's happening here with care homes. The government is not saying everybody has to have the vaccine, but they are saying if you want to work in a care home and come into contact with all these vulnerable people, in order to protect the vulnerable people, you have to be vaccinated. And so it's not quite like a dictatorship where government is forcing everybody to do things. They're looking very carefully at the activity and saying, well, actually, this activity, this job, this role involves exposure to vulnerable people, and we need to protect the vulnerable people. And that's why they've taken that decision, and they haven't taken it lightly. But I absolutely appreciate where you're coming from. It's an unusual thing for the government in this country to do, but they've done it for good reason. Hepatitis B and surgery, for example. There are other examples.
Thank you for that, Paul. So we have.
I think that.
Sorry, Shelley, did you want to say something? No. So we have come.
Yeah, but you guys have to remember during this pandemic.
Sorry, we've lost you, Shelley. Shelley Ann, can you repeat? Can you repeat that? No, I think we've lost Shelley. So I think, well, we have overrun on the session, so I think it might be timely to draw the session to a close. But please, if you do have any more questions or queries or points that you'd like to raise, do pop them in the chat, and we will continue to look at that and answer your questions. So I hope everybody's found it useful and helpful. And just as a reminder, this session is about giving you as much information as possible to help you make the right decision for you. So it is a matter of choice as to what you want to do with regards to having the vaccination or not. So I hope that you have more information to be able to help to make those decisions. And if you do have any more queries, as I've said, we are here. Use the chat and use the link to the Vaccination Hub as well, and we can always direct any queries that you have. So thank you to everyone for joining, and thank you to Sedina and to Paul for giving up your time on this session. It has been really enlightening, and we've covered a breadth of clinical and practical issues, but also those ethical and moral issues as well, which has been really interesting. So thank you.
Yeah, thank you very much.
Thank you all very much. My parting comment is, if you have any information, please speak to us, the healthcare professionals. As I said to somebody, if you need your tree cutting down, you're not going to speak to a baker. So please speak to the people who know about it. Can we please be wary of Dr. WhatsApp, because we don't normally go to Dr. WhatsApp when we've got other health issues. So can we kind of give Dr. WhatsApp a bit of a miss, because there's a lot of very worrying information that puts the fear into people, really. And so speak to the healthcare professionals. We're always here to listen. We really are. And no question is silly. We want to hear it and help you.
And you can contact your own GP and say that you would like to discuss vaccine as well. And any other clinician that you feel most comfortable with, then please do contact them, and alongside our email address as well if you want our support. But thank you very much, everybody, for joining, and thank you for your questions. It's brilliant to hear from you.
Thank you very much. Thank you. Thank you. Bye-bye.
Bye-bye.
Bye-bye.